Hey everyone, and welcome to today's Explainer. I'm really excited you're here because today we're diving into a piece of human anatomy that is absolutely fundamental to who we are, how we look, and how we function. We're talking about the maxilla. And, I really want you to think of this not just as a bone, but as this incredibly dynamic piece of 3D architecture sitting right in the middle of your head.
Let me start by asking you a pretty straightforward question. What actually forms the structural core of your face? A lot of us immediately think, oh, it's the cheekbones or maybe the jawline. But the reality is way more central. Sure, the maxilla is commonly known as the upper jaw, but as we'll see as we go through this, it's actually the vital architectural hub of the human face. Literally the keystone connecting multiple structural systems together.
So, here's our game plan. 1. Introducing the maxilla. 2. The body and surfaces. 3. The 4 key processes. 4. Connections and articulations. And 5. Ossification and age changes. Let's get to it.
Section 1. Introducing the maxilla.
All right, so let's get a sense of scale here. The maxilla is a massive player in facial anatomy. It's actually the second largest bone of the face, right behind the mandible, or lower jaw. And technically, you have 2 maxillae that fuse together to form your entire upper jaw. But their job definitely doesn't stop there. Each maxilla builds critical parts of your face, your nasal cavity, your mouth, the orbits of your eyes, and even those deep, hidden spaces like the infratemporal and pterygopalatine fossa. It is a true multitasker.
Now, because this bone is so irregular and complex, if you were just holding a disarticulated one in your hand, it can be kind of tricky to tell left from right. But here's how you orient it in 3D space. First, look for a deeply concave border on the anterior surface. That's the nasal notch. You want that pointing medially, towards the midline of the face. Second, take the alveolar border. That's the part with the upper teeth sockets, and point it downwards, so the convex curve faces outward. Finally, make sure the longest extension, the frontal process, is pointing up. Get those anchors right, and you've perfectly oriented this puzzle piece.
Section 2. The body and surfaces.
So let's treat this like we're exploring the main room of a building. The main body of the maxilla is essentially a hollow pyramid. The base of this pyramid is directed medially, forming the nasal surface, and the apex points laterally toward your cheekbone at the zygomatic process. But remember, it's not solid bone. It encloses this massive air-filled cavity called the maxillary sinus. And because it's pyramidal, it's got 4 distinct walls or surfaces we need to map out.
Let's check out the outer walls here. Look at the anterior, or facial surface. Just above the incisor teeth, you'll spot a slight depression. That's the incisive fossa. If you move laterally, past the ridge of the canine tooth, you'll drop into a larger, deeper depression called the canine fossa. And right above that, a super important landmark called the infraorbital foramen. This little hole is absolutely crucial because it transmits the infraorbital nerve and blood vessels right out onto your face.
Now, the medial surface on this slide is where things get really interesting. It forms part of the lateral wall of your nasal cavity. If you look at the upper posterior section, there's a huge, highly irregular opening. That's the maxillary hiatus. Basically, it's the doorway straight into that hollow pyramid we talked about earlier, the maxillary sinus, or as it's historically known, the antrum of Highmore. In an intact skull, neighboring bones partially board up this opening, but on an isolated maxilla, it is incredibly prominent.
Section 3. The 4 key processes. Moving out from that central body, the maxilla reaches out to the rest of the skull through 4 distinct branches or processes. Think of them as the connecting corridors of our building. You've got the zygomatic process, projecting laterally to meet your cheekbone, the frontal process, which is the longest, reaching straight up to the frontal bone of your forehead, the alveolar process, dropping downward to anchor your teeth, and finally the palatine process, which is this thick horizontal plate projecting inward. That one actually forms the front 3/4 of the roof of your mouth.
To ground this in something you can probably feel right now, let's focus on that alveolar process. In a human adult, one single maxilla has exactly 8 tooth sockets along its arch. The absolute deepest socket belongs to the canine tooth, which actually creates a visible ridge on the front of the bone. The widest sockets are all the way in the back for the molars, and those are even divided by little bony partitions, called septa, to firmly hold the multiple roots of the molar teeth securely in place.
Seeing them all together really illustrates how these processes work simultaneously. In this lateral view, you can trace exactly how the frontal process reaches dramatically upward to act as a structural pillar connecting the jaw right to the forehead. Meanwhile, down below, that thick alveolar process creates this incredibly sturdy foundation for those 8 teeth. It just goes to show how the maxilla really is the ultimate structural bridge in the face.
Section 4. Connections and articulations.
Okay, so let's look at the surrounding neighborhood. The maxilla is a massive connective hub. If we walk around its borders, it articulates with 9 different bones. Superiorly, it hits 3, the nasal, frontal, and lacrimal bones. Laterally, it reaches out to just 1, the zygomatic bone. But check out the medial direction here. This is by far the busiest intersection. Medially, the maxilla connects to 5 separate bones: the ethmoid, the inferior nasal concha, the vomer, the palatine bone, and of course, it joins right up seamlessly with the opposite maxilla at the midline.
Section 5. Ossification and age changes.
For our last section, let's look at this over time, because the maxilla is definitely not a static object. Its ossification, where the tissue actually turns into bone, starts incredibly early. We're talking the 6th week of intrauterine life. Now at birth, the maxilla's shape is vastly different from an adult's. Its side-to-side and front-to-back dimensions are actually greater than its height, but as you grow up, that flips. The vertical diameter becomes the greatest measurement. This massive increase in height happens because the alveolar process grows downward for your adult teeth, and that internal maxillary sinus expands tremendously.
But that structural journey keeps going. If you contrast birth versus old age here, it is absolutely fascinating. At birth, the body of the maxilla is basically just the alveolar process, with tooth sockets reaching almost all the way to the floor of the eye orbit. Then it grows tall, right? But in old age, especially if teeth are lost, the bone actually reverts back to that infantile condition. The body reabsorbs the alveolar process, drastically reducing the maxilla's height, which completely changes the structural shape of the lower face over time.
So I'll leave you with this. It's so easy to think of a skeleton as this rigid, unchanging frame, right? But your skeleton isn't static. The maxilla, the literal core of your face, is constantly responding to your body's needs. It grows to accommodate adult teeth and sinuses, and it literally shrinks and reshapes itself in old age. It's pretty amazing to think about the dynamic, ever-changing architectural blueprint living right beneath your skin. Thanks so much for joining me for this explainer, and keep asking questions about the incredible